thinking about that telehealth might require different scheduling or really improved scheduling, like thinking about what visit types are appropriate for telehealth and maybe doing training around that, and thinking about that balance, which we talked about, between having flexibility so that you prevent unused slots and kind of what you can handle internally in terms of keeping things running on time. We see that in most cases, simplified scheduling definitely improves patient access and decreases staff time in scheduling appointments. So that can have a positive impact on the third next available and especially the call abandonment rate. You do have to be really data-driven about how you approach your schedule, though. So for example, if your cycle time for telehealth and or in-person provider time are closer to 18 minutes, then you really need closer to a 20-minute simple schedule. Versus if that time is closer to 12 minutes, then a 15-minute schedule might be more appropriate. And so the way that you move from kind of what that old schedule looks like to what the new schedule looks like is you shouldn't decrease or increase the number of patients that you schedule unless you also need to schedule more patients to hit your productivity goals. So you probably, if the examples that we show have more or less patients scheduled than you do, you don't want to change that number. That should be based off of your productivity. The key here is moving everything into one length of appointment, getting rid of any double books, getting rid of any multiple, like longer appointment lengths. And really a simple schedule is just more realistic in the sense that we know all visits are not the same length, right? But in practice, we're not very good at predicting it, which ones are going to be long or short. And you can see that because rarely are patient care teams like, yes, our schedule is working perfect. And if they are saying that, please let me know because I want to steal your schedule. What simplified scheduling has the assumption of is that most of the time, all those different lengths of appointments are going to come out in the wash. So we just make it as easy as possible to schedule an appointment so that that's not where we're spending our time. It's really just about getting the patient on the schedule. And then, so if you've mastered kind of those basic scheduling techniques for telehealth, then the next step and where you go is really focusing on creating a multidisciplinary team that can provide telehealth care. So for example, making sure that you're providing warm handoffs to behavioral health, to dental, to care coordination, or whatever other services that you have for patients. And this is definitely that kind of next level piece because this requires a lot of coordination between staff across departments. But definitely you want to make sure that you're not losing out on some of that high quality care that we know that community health centers provide. And part of that is having multiple services on site or being able to provide that in a telehealth capacity. Amanda, do you want to take over and tell us what we're seeing?
Yeah, absolutely. I mean, I think getting into even number 6, what you were just talking about, Adrienne, in terms of needing broader roles for support staff to handle this. And I saw some interesting chat between some folks talking about when you would go through like polishing and asking those want it, need it, keep it questions. And so I just want to respond to the chat briefly, which was, I don't know if it's always something like someone at the call center or a clerk could do. I love the suggestion provided in the chat that it's something you look at over huddle or you do during visit prep, because sometimes it needs the care team to weigh in on the want it, need it, keep it questions. But I will say that the more you're bringing in your front care team or call center, like for example, I was coaching a dental team who had a call center person join huddle every morning. They'd like just virtual into the huddle, is they started to learn based on the huddle conversations, what was more appropriate for telehealth versus in-person. And so they got better and better at it. Is it going to be perfect every time? No, but I do think you could look at how to make that cross-functional team really strong and how to bring them into huddle so that you could do less of like fixing the schedule the day before and more fixing it upstream at the time patients are scheduled.